Hey everybody, good morning. We're happy to be back with you today on the ABC 15 Facebook page. Carla and I always have plenty to talk about when it comes to education, but especially right now with so many things going on. And so we're hoping to take, these next 40 minutes or so just to talk about some of the big headlines in education right now, things that we've seen happening this week, things we expect to see in the coming days and the coming week. So please feel free to weigh in over on the side here. We can see your comments. And so if you have questions or anything that you want to add, please go ahead and share that with us and we will do our best to address it. So as we get started here, Carla, I just have to ask you, as you are in a boat that so many parents are in right now, you've got 3 kiddos at home learning. How is that going for you guys?
Yeah, well, good morning. Good morning, Danielle. Good morning to everyone watching us. We appreciate you. We welcome you and into our homes here. This is second week for us, the second week for digital online learning, virtual, whatever you want to call it. I'm going to be really honest. It hasn't been necessarily that bad. It hasn't been necessarily easy. It's just kind of going with my older kids that are in 7th grade, so they're starting junior high. I feel like it's been a little bit easier in the sense that they're just older, a little bit more independent. But then I also have a 4th grader, and just kind of helping her stay on track is one of the things, Danielle, that we've had a really hard time. I was sharing that with you yesterday. Yeah. If somebody's not there next to her, just kind of really guiding her, she veers off into into other things that are in her room, playing with her dolls, playing with her blankets, anything that she finds her hands on that she can really dwindle off into. That definitely happens. And I think maybe our comments will come along that way, that from parents sharing that same kind of frustration. Yeah. I was sharing with you about, I've got a 4th grader, but think of those little kindies and those 1st graders. Oh my gosh, how much they need redirection. Yeah. And I can't imagine, if it's hard enough for me with a 4th grader, I can't imagine what it's like for 1st and kindergarten. So we welcome those comments from either a teacher or a parent who's having to spearhead that direction for those little ones, to give us your feedback on how you're doing, for sure.
Yeah, absolutely. And I think that kind of segues nicely into one of the big things we're watching right now is, especially as Labor Day approaches and those health benchmarks and the numbers start coming down a bit more, we are seeing more school districts starting to talk about that idea of moving to some sort of an in-person learning model. Mesa last night at their meeting was talking about potentially moving toward their modified in-person possibly by September 14th. They're still waiting for the metrics and they're surveying parents right now to see the interest, but that's the largest district in the state that is starting to talk about bringing students and teachers back on campus. Gilbert made the decision last week that they're going to start a hybrid September 8th and then move to that full in-person September 22nd, assuming those benchmarks still look good. And there are 7 other school districts who had set Labor Day as a target date for students returning. I've checked in with all of them. So far, I've heard back from a couple of them. Scottsdale Unified, they're going to be discussing this next Tuesday at their board meeting, September 1st. They're hoping to look at the guidance and to decide if they can start having students and teachers back on campus. So of course, that's a big thing right now. And I think we're only going to see more and more districts considering that. And Carla, you brought up a great point last night, because the Madison School District was just talking about, bringing kids back to in-person learning. How do you do that? And they particularly mentioned those younger kids who are really struggling with that remote learning.
They did. In fact, Dr. Baca sent out a letter home to parents. We got a copy of that letter, and he addressed the issues with our 1st graders, our kindergartners. I saw a parent just earlier say that, she's got a 1st grader. This is the time when reading really flourishes and all of those fundamental skills are really streamlined and gathered. And so for her little one, Miss Marquez there said earlier, it's been really, really hard. It's a struggle. It's an everyday struggle. So they mentioned those parents, they mentioned those comments last night at the meeting, but they've also set, in their previous meeting on July 21st, that they would go ahead and wait until the end of the 1st quarter, which is October 2nd. So the one thing that they added per se to their board meeting and to their proposition is that they are going to now look at the City of Phoenix specific data from ADHS, from the Department of Health. So they're adding kind of like that microscopic kind of view of their district as opposed to just the county in general. We know that our county is so big, right? It's ginormous. You know, you go all the way from Apache Junction all the way down to Avondale. You're talking, you know, so many miles in such different communities. So it's really hard to make a blanket all, you know, this is what Maricopa looks like, because the East Valley could be very different than the North Valley, than the Central Phoenix area. So nothing real change as far as Madison is concerned, just that they're adding that little bit of microscopic kind of view on the City of Phoenix, which is where the Madison Elementary School District is located.
Yeah, and I think that's something that we've seen with the county dashboard that they put out, the Maricopa County dashboard. And I'm going to attempt to share my screen here. I think I'm getting some feedback, so I apologize if the audio is a little wonky. But I'm going to attempt to share my screen because I don't know if those of you out there have been able to check this out, because you know, the county did do a great job of actually kind of, you know, showing or giving that, you know, micro look. Here, let's see if I can go back to what I had. Okay. So it's on maricopa.gov. You just go to their COVID-19 section. You go to their section for K through 12 and childcare facilities, and you go to their reopening dashboard and guidance. And this is updated every Thursday along with the state benchmarks that we see. But this is great because it's a great snapshot of the county as a whole. You can search by zip code, you can search by city, you can search by school district. Obviously, in an ideal world, we would have all of the school districts in green. You know, that's kind of the green light where you meet those benchmarks for traditional in-person instruction. The yellow indicates a moderate spread in the community, and so the recommendation there is a hybrid type model. And then you have these red areas, that's where the substantial community spread is, and they are still recommending virtual only with on-site support services. But, you know, you can just type in a district. So for instance, let's put in Scottsdale Unified, because I know, as we've said, they're set to meet next week about this. And it'll take you right to it. And there you go. So you can click on it and you can see, okay, they're at the moderate risk level. You can see their cases, their percent positivity, their COVID-like illness. And so this has been a really great tool for those school districts, I think, to really get a hyper local look at what the community spread is like in their area. Because, you know, even the state guidance mentions in their safely returning to school in their handout that they have, that one of the greatest indicators of transmission in schools will be that surrounding community spread. And so I think that's been a great tool for districts and also for parents, you know, or just members of the community who want to look and kind of see where things are at in their specific area. Not that it's perfect though, because we've talked about how a lot of kids come in from other districts. You know, we are open enrollment. And so that's kind of a unique challenge that we have here.
And, you know, one of the things that they mentioned last night, to piggyback off of that, Danielle, in the Madison Elementary School District, they said, you know, we're never going to get down to a 1% or a 2%. Not that we're never going to, but just the goal isn't to have zero, right? The goal is to get it under 5%. And so they were very clear on that. And I think we all know that, you know, this is not going away anytime soon. We're not going to have a situation where there is zero COVID cases, but we do want to get it down to that below 5% level in order for us to be able to send our kids back to school. And they had letters from parents, you know, saying how frustrating it can be for that kinder and first grade. I'm listening and looking at your comments here. Francis Caldera earlier said this is too stressful. Another parent mentioned their child being depressed. Yeah, you know, it is very true. It's a difficult time. I do notice a lot of tears, at least here at our home. I'm sure a lot of you moms out there will definitely, you know, coincide with me saying that it's definitely not the ideal situation that we're in, but we're making strides, right? Every day I feel like it gets a little bit better with the days coming in and with our internet connections being fruitful and productive. But anyway, it's difficult. It's difficult for all. And that's what I keep telling my kids. We're not alone in this, guys. You're not the only one doing this. It's everybody. So knowing that, it gives me a little bit of comfort, as I'm sure it gives a lot of us parents, a little bit of that feeling of we're going to be okay, because guess what? We're all going through this at the same time.
Right. And that's why I so appreciate you being so open about your experience, so that people out there realize, hey, we're working parents too, we're right here in this with you. And that's why, we're so passionate about this particular topic, because it does impact so many families out there. And I did see a comment here on the side from Lexi Austin. This was about 7 minutes ago. And it's unique because we don't usually hear from students in these Facebook sessions. And so Lexi is a senior in high school. And she says that she hates it, stressed, and that she can't believe that her first day of high school is online, and that she'll never get that chance again. And so we feel for you, Lexi, and certainly all the students and families out there who are really frustrated and just really wanting to go back to school. But of course, the biggest concern is safety, right? And how do you keep the spread down, keep those numbers down as you welcome students and teachers back to campus? And that's obviously the greatest driver behind all of these decisions that are being made, is how do we limit that spread? And that kind of brings us to the topic of how schools will be reporting cases on campus. Now that we have students in classes, we have Queen Creek who's back, we have the legacy schools that are back, we have the American Leadership Academy is back, and EduPrize is set to start Monday. And so we're seeing kids on campus. So now the question becomes, how do schools handle when they have a positive case on campus, whether it's a student or a teacher? And what's the notification process for that like? What will parents know? What will students know? And Carla, you and I were actually talking about this the other day, because the state just released a new executive order, kind of new guidance as far as how schools are to report that information.
Yeah, absolutely. So what I gathered, and I read it thoroughly yesterday and the day before, just because I want to make sure that we know what is being said. We've actually reached out to the Department of Health Services, trying to get an explainer type story for you parents out there, and for myself, quite honestly, just what exactly does it look like? We haven't gotten any results as far as getting a sit down interview with us, being able to really question, okay, so what is that process going to look like from A to B, and from point B to C, and C to D, so to speak. The only thing that I gather from it is that they will consider 2 people within the campus that are not related and not epidemiology connected. And so that word, I was like, what does that mean? That means that they did not come from the same home or the same source. Is that what you're gathering, Danielle, from that word, from that big word?
So and it's hard because, we kind of they sent out the initial release, but then, our team had to kind of dig through the actual executive order to see what it really meant. And so, I think they classify an outbreak as, 2 cases on a campus where it's not obvious where that exposure came from or where they got it, so they're not siblings, they weren't at the same home, that it's 2 that you can't really trace where they got it from.
Correct.
And so I believe that's what they consider an outbreak. And that is when the school is required to contact their county, or they say local, but their county health department, which then informs the state health department.
Right. So the state is the one that is putting out the executive order. I know it was Dr. Christ who put it out, but then it's the actual county health departments, the ones that are receiving the information from the individual schools. And so I know that at my kids' school, they sent out a health plan that was about 14 pages long yesterday. And I checked them on it, and I saw the verbiage that was very much the same type of verbiage that is in Dr. Christ's executive order. It's in the health plan as far as notifying. So it's really an administrator who is on on campus, or the nurse who is set to have to notify that county health department within 24 hours. I know that at our school, they won't release the name of the child or any of that personal information. They will simply tell us, in a letter, pretty much. I don't know if any of your parents had a chance to see, but Kyrene had an exposure situation, and they didn't release any names. They just said, your child has been around this person who's tested positive. And in Kyrene's case, I know that they wrote, please come pick up your child as soon as possible. Is that, was there anything else in that Kyrene statement, Danielle, that you think is important?
So the Kyrene district was great in answering right away when we reached out and said, hey, is this true, what we're hearing? They sent us a copy of the letter that the principal of Kyrene del Milenio, that the principal sent out to the families who were impacted. So I asked, okay, well, how many families may have been exposed? And there were 7. So she said that they sent out those 7 notifications, and that it told them that those students had to quarantine until, I believe it's September 1st, or there's a date next week. So they had to do that 14-day quarantine. One thing I was kind of surprised about, though, because there's a gray area here as far as HIPAA and, how much information they can give, how much they can't. That letter from Kyrene actually detailed the exact classroom, the teacher's name of that classroom, and the 2 exact bus routes that were impacted. And so I was actually kind of surprised that we were given such specific information, because that really does narrow it down to, what students may have been in that area. And again, Kyrene is learning remotely, but they, like most districts, are offering in-person support services in compliance with the governor's executive order. So there are some students on campuses right now receiving special services, whether that's, one-on-one instruction or services in line with their IEPs. Carla, you did a great story on the preschool that was open. And the teacher working with those kiddos right now. So there are students on campuses, and we are starting to hear, yesterday Peoria had a bus driver test positive for COVID, and they notified staff and families who may have been impacted. So the big difference in this executive order is that they now have to turn around and report that case to the health department, just like they do mumps, measles. Before this, that wasn't mandated.
Right. And one of the positive things that I really want to shed light on with that preschool story that we did last week, and that I want to just share to parents, is if the cup is half full, Miss Elsie Nicholson over at Santan Elementary in Chandler, she said, if anything, I'm now getting that one-on-one attention with one-on-one ratio or 1-to-2 ratio with the kids that are coming to in-person learning. So these are kids that, for whatever reason, they are not able to accommodate them virtually, right? So the computer screen is just not the best learning environment for that child, whether it's deemed by the parent and the district, or the parent and district together. There are those children that are still coming in. And I thought, that's really neat that she's seeing it this way, that she's able to, she doesn't need as much time with these children, because she's getting that really, really good one-on-one time. And so it's nice, because she said, usually I have 15 kids in one classroom pre-COVID. And so sadly for her, though, and I just want to give a shout out to her, because now, after she's done with her in-person learning time, she goes off and she records her virtual classes, and then she sends those virtual lessons to the parents for the children who are at home, who can't come to school. Those lessons. So she's got a double duty. She said at first she tried to do both the virtual and the in-person at the same time, and she said it was really difficult. She said, I just thought, what, no way, I'm going to have to just focus on the in-person when they're in person, and then record the lessons for those who are at home. So I feel like we're all in this together, in the sense of just learning by trial and error, right? We try one thing and then we're like, okay, that's not going to work. Right. I know with my daughter, she kept getting booted off of, she kept getting taken off of the internet for some reason. So we just had to really work on that for a while. And how do we mitigate that in order to keep the day going? Because we can't continuously be in this breaking down mode. So anyway, kudos to the IT's departments. I know that last night's Madison Elementary School District, they've mentioned how many tickets they've gotten for IT departments. So, I mean, everyone is in it trying to mitigate and help solve the problems as soon as possible so that kids can stay online.
Yeah, definitely. There's a comment here that I think is a great segue to kind of a bigger issue here. Lila J. Reyes, so this was about 8 minutes ago, saying, so it's safe to open movie theaters, but not in-person learning. We had that big announcement from Harkins that they will be opening all of their theaters with distancing measures and safety measures in place on Friday. But this kind of reminds me of a topic that we had during one of our recent Facebook town halls, where Will Humble, he's with the Arizona Public Health Association, said that, you have your schools as far as places that could cause spikes in cases. You have schools, and then you also have bars, restaurants, movie theaters, things that people do for recreation and nightlife. And that if you open those at the same time, that you may get such a big spike that it almost shuts, kind of cancels out one or the other. And so, we don't have any answers for this. We don't know what's going to happen, but I think it'll be interesting to see what the numbers do as we have movie theaters reopening, gyms reopening. The state saying yesterday that the benchmarks could be met for more businesses to reopen as we see schools start to reopen as well. And what that will do for the numbers and what that will mean long term as far as if students are able to stay on campus or go remote. And so it's interesting as we see, schools starting to reopen at the same time, and also the state trying to reopen at the same time.
Right. And it's that fine balance, right, that we don't want to overload our healthcare system, right? I mean, I think, about us delaying in-person learning. And I also think, when we were supposed to open up to in-person, our numbers were still very high. I mean, and we've seen the downward trajectory, and I think, thank goodness we're seeing that. I want to thank those who are out there who may not necessarily be parents, but of young children, but maybe you're doing your part by wearing the mask. You're wearing your mask and social distancing, and doing the proper hygiene. I want to thank you, because it really takes a village in order for this to really outshine and come through. And it's for our kids. So as a mom of 3 who's eager to send her kids back to school, thank you for all of those of you who are out there doing your part, making sure that we stay safe and that we continue to bring those numbers down inch by inch. I know that Governor Ducey mentions a lot the R naught number, and we're doing great as far as, I think it's at a 0.82. That was a couple of days ago. That number is really the kind of like the formula that is used as far as if one person is infected with COVID-19, how many will that person infect in the community? The lower that number is, the better off we are, because it means that we're mitigating and we're keeping down the number of the level of community spread. And so it makes me proud to be have Arizona's number be so low, because Danielle, in July, that number, I remember him showing it on TV when he did his press conferences. I believe it was like at a 1.15, 1.20, if I'm not mistaken. So for us to have brought it down thus far, kudos to everyone who's doing their part.
Yeah, 1,000%. And, of course, we hope that the numbers continue to trend in this direction. And tomorrow will be interesting. Thursdays, again, is when they update the state dashboard and when they update the county dashboard as well, with what school districts are looking like. And so I know a lot of districts are going to be looking at tomorrow's data as they plan, possibly next week, to make the decision if they will bring students back after Labor Day. So I think tomorrow's numbers will be really important. Something else that I think we about, the universities are welcoming students back. That's a big deal. ASU, of course, already has students on campus. U of A in Tucson has students on campus, and I will actually be up in Flagstaff on Monday because NAU is welcoming students back to campus. I know with ASU, they had previously said that they weren't going to share how many cases they had on campus. But yesterday, it seems they changed course, and I think it was 160 cases on their campus. And U of A is actually, they have a whole dashboard that they've created where you can go to their website at any time and see how many cases they have on their campus. And so that's an interesting resource, especially if you have kids who are going to school down there or family down there. That's another great resource as well. But I think that will be telling too of, you have students living on campus and sharing such close quarters. And I know all the universities, GCU included, NAU, ASU, U of A, have all prepared for when they have cases, not if, because they know it's going to happen. And they've turned dorms, GCU turned their on-campus hotel into quarantine areas. And, they're actively trying to prepare to try to slow the spread. But as we've seen in other states, like in North Carolina, University of Notre Dame having to shut down because of so many cases, it'll be interesting as well to see how this impacts the university students too.
I know I reached out to U of A yesterday, and there's a website that is I think it's part of that dashboard that you were mentioning. It's COVID19.arizona.edu, and it's so comprehensive. It's got so much great information. If you're a parent of a Wildcat and you haven't touched base with that website, I think it's definitely a must. I know that Dr. Robbins was on was on our network earlier this week talking about their testing and all their testing protocols that are taking place down at the U of A. And I know they've been very, very much at the forefront of testing their students throughout the summer. So let's just wish all of these college students really the very, very best. I know, piggybacking on what you were saying about ASU, I read Dr. Crow's information last night as far as congregating and students who decide to have, a house party or any type of situation. They will be handled. They will be disciplined. And his language and his verbiage on his statement was very much of, we will not let this go. We will have a zero tolerance policy. We will definitely take this very, very, we'll definitely discipline you if you are found to have been part of a party or part of a get together that does not meet the CDC guidelines. So it's really sending our message to this population of entering freshmen, sophomores, juniors, seniors at the universities that, yes, that's what we want to do, right? College is all about mingling and getting together with your colleagues and your friends. But at this time, we want to keep you guys on campus. So, and we want to keep you at school learning for those who have opted for in-person learning. Yeah. So doing your part. And so Dr. Crow has definitely sent that message, sending out that message last night.
Yeah. And the University of Arizona president has been very outspoken saying, we can control what our campus looks like and what our classrooms look like and what our dorms are like. But once students go off campus or, into the community, or there's only so much they can do to kind of corral all of that. Right. And so I think that's where that call for support from the community and from their students will be really important. Something else kind of interesting in some of the research I've been doing for NAU, I know U of A and I believe ASU has something similar. The technology that they're using, I just thought this was really cool to kind of help students track, COVID-19. I know U of A and NAU have apps that will actually notify students if they have possibly been exposed to COVID-19. Up at NAU, they're using like little Starship robots to help deliver food and supplies so that they can try to make it as contactless as possible. It's called Louis. They have this, their touchless kiosks where you can get your temperature taken. I mean, it really is kind of amazing, all of the technology that they've been able to roll out to try to, at least help students stay informed and stay safe. And, right. I know especially up at NAU, Flagstaff is a smaller community. And I think folks up there are a little concerned about all of these students coming back to campus, especially as Flagstaff Unified, they've chosen to keep their district remote learning through the first quarter. And so, I talked to their superintendent yesterday, to his office, and got a statement from him saying that, they're trusting that NAU has the right mitigation measures in place, but that they also realize that the decisions that they make as schools impact the entire community. And so, I think with students coming back on campuses, it's not just that particular university campus, it's the domino effect, if you will, to that surrounding community.
Absolutely. And if I could just chime in here, I know another topic that I've kind of dived into and that I'd like to share with you parents. This week, I focused heavily on a story that came out of the CDC that Latinos and African-American children are hospitalized and, have instances with COVID-19 at higher rates than their white counterparts. Latinos at 8 times higher than white children, and African-Americans 5 times higher than white children. That story is going to air again this afternoon. It aired this morning. And so just I just want to share with you what I learned. And one of the things that I read the entire study, and I talked to a doctor at Valle del Sol, who's been a medical director there for a while. He's treated COVID-19 patients. I talked to an assistant superintendent with Tolleson Union High School. And then I talked to Janelle Woods. She's with Black Lives Forum. And all 3 of them said the same thing, which was really neat to hear from 3 different people. And that is the access to quality healthcare. But one of the things the study talked about that I also want to share with, especially with the Latino community, is the rates of obesity. And so a lot of these children who were part of the study, 576 kids total, 14 states. So it's not just in the Northeast area or just the Southwest. It's really across the country. Most of these kids had that underlying health concern of obesity. And the Latino population is close to 26%. So over 1/4 of, Latino children in America are considered obese. And so anyway, just for me, Danielle, personally, what my kids eat. And so if I can just say the message, and I'm taking on the message for myself, it's, trying to keep that activity going on in our children, heading out to the park. I know it's so hot outside right now, but really, really keeping our kids eating healthy foods and trying to do, we're doing our best, right? We're washing our hands, we're wearing masks, but this is like another level that we can definitely take this COVID-19 pandemic and really use it for something of a greater good for our family. So I just thought I'd share that with you. That story is online, and it's also, again, airing again later on today if you'd like to watch it. And there it is, abc15.com/schools.
Yeah, no, and that's great information too, because so often we just talk about the numbers and we don't hear a lot of some of those underlying risks, especially in children. So that's pretty eye-opening. And on that topic of student health, I actually, tonight I have a story airing about school nurses and how they are preparing for students to come back for in-person learning. I spoke with a nurse. She's the resource educator nurse for Mesa Public Schools. She's also a member of School Nurses Organization of Arizona. And we talked a lot about the fact that school nurses are gearing up to be incredibly overwhelmed by students because the county health department, or the county department of public health, has essentially advised school districts that if a child comes to you with any symptom, and I say any because the list is incredibly extensive. It's everything from runny nose to headache to stomach ache to fever to cough to a host of things, that if they can't identify the underlying cause of that, so for instance, if a child has known documented allergies or has some gastrointestinal issues or things that are on file ahead of time, if they cannot trace a symptom to that, they are advising them to pull those students out and send them home to potentially quarantine for up to 14 days until those symptoms are gone. So that's a lot when you consider when you send kids back to school, and even the health department acknowledged. So that basically encompasses every student we see for the first few months of school, right? And so, she talked about how, they have screening protocols in place to try to not unnecessarily, send kids home because they know this is a tough time for parents. But that, they're going to be pretty overwhelmed, especially in the beginning. And so they've set up their health offices, look very different. They have plastic barriers and shields and all sorts of PPE in there. And, they're working with staff members too, to kind of say, okay, if you have a student who scrapes their knee, can you give them a Band-Aid so that I can have room in the office for students that may have other symptoms? Because you're trying to, physically distance in a small space. And something else that she brought up too, as she's a member of the school nurse organization of Arizona as well, is that there's no mandate in Arizona as far as who is manning your health office. So you don't necessarily have to have a 4-year educated nurse or a specific health assistant. And she said that she's particularly concerned, especially for those rural districts who may have a parent volunteer who took a first aid class who's manning that office. And, they certainly hope that they never want anything like this to bring to light the importance of having school nurses or, medical staff on your campuses. But a lot of times, just like we see with guidance counselors and social workers, school nurses are a lot of times some of the first positions to go when they make budget cuts. And so a lot of these districts are kind of already understaffed when it comes to their nursing staff. And now they're really preparing for an influx of student visits. And so that's the focus of my story for tonight. But it was enlightening speaking with her about how they're, she said everyone in the school community is really on the front lines of, but, especially those who are in the health office, kind of that first point of screening for symptoms and trying to decide, should a student stay, should they go, and working on that. So it was very interesting.
By any chance, did she touch on the flu season coming on board along with COVID and what that, and her maybe kind of an idea as to what she can expect as far as those two viruses that are so similar? COVID-like related illnesses is very much like a flu illness as well. Mm-hmm. Did she touch on that at all?
So we didn't get too deep into that because she showed us a bunch of the PPE that they're ready and what they're distributing to health offices. But I know that is a big concern, as well as those viruses kind of coming together. And the other thing she mentioned was how parents can kind of help out before their students, if they're returning to in-person, things they can do as far as calling to make sure all the medications are up to date, that any of those underlying illnesses or things that a child may have are on record. She also pushed immunizations being up to date, saying, I know they've been learning online, but that's still a requirement for in-person school. And we need to make sure that those immunizations are up to date so that we don't have other illnesses popping up and kind of leading to more chaos. And so there's a lot that's going to go into it. And, anything parents can do, obviously they said, said they understand that sending kids home for a runny nose is going to be difficult for families, but that this is what they're charged to do because this is such an unprecedented year.
Yeah, I know a few weeks ago we did an immunization drive out in Mesa, and we spoke with the nurse there, and that's exactly what the message she was relaying is, hey parents, this is what you can do. You can make sure that your immunization records are on track and they're up to date so that we don't have to get boggled down with all of those, issues. And at the same time, have to deal with COVID-19 and keeping everyone safe. So I know that they're really pushing immunizations. They actually also mentioned to me that the county is going to be unveiling a very robust, this is all coming from Mesa Public Schools, the nurse that I spoke with. This is not coming from the county, but she said the county will be putting out a robust flu shot, flu immunization type of season because of what we're going through with the pandemic. And so I know I've already seen at like CVS and some of the pharmacies that flu shots are beginning to be available. I was told that September is that kind of time frame. And so just spreading the message of concern from our nurses, our lovely nurses that do so much. And yet there's sometimes, as you mentioned earlier, we know that some of the schools don't even have an actual registered nurse, right? Because of budget cuts. And not that we aren't thankful for those who are there, we are, but at the same time, that registered nurse does help bring so much more to the table as far as her background or his background on how to mitigate and how to help a school really, really, really handle a situation like COVID-19 and all of the other things that come with a school setting, like the runny noses and, you know, the bloody noses and the scrapes on the knees, the broken arms, all of that kind of stuff.
Yeah, and just sticking with Mesa, since we're on that topic, they actually have preschoolers and their self-contained special ed students coming back today and tomorrow. And so she kind of stressed that this is a big week. They've had some kiddos in their Explore program, which is like the all-day childcare, and they have had some kiddos on campus for in-person support, but this will be even more students coming in. And she said especially some of those medically fragile students who have feeding tubes and trachs and, require very hands-on medical care in school. She said that's also a challenge because there are some procedures as far as nebulizers or things that like spray into the air that they can't actually do right now because of COVID concerns. And so those kiddos are going to have to stay home for virtual learning a little bit longer until they can figure out how to navigate that. But just everything that goes into this process. And I think it's been, I don't know about you, but for me, it's been eye-opening as someone who's in it and looking at the governing board meetings. And, you and I talk all the time about, oh, this district's doing this. And there is a lot of thought and processes that are being followed in trying to get students and staff back onto campus.
Oh, yeah. I saw it firsthand with Madison last night, a 2-hour meeting, and all of the scenarios that they brought up, that they crossed paths with. They have a set of doctor parents that are on this specialty board that help, advise the school board. I thought this is amazing just to know that, all of this effort is being put on by volunteers. In these cases, these parents are volunteering, giving up their precious time to really think of all of the different scenarios that could come up and really help the schools open up when the timing is the right time for that specific community. And as I mentioned earlier, just because it may be the right time in Phoenix, it may not necessarily be the right time in Mesa. But we do know that as a community, we intermingle, right? We don't stay within our boundaries. We cover and we transport ourselves to and from. And so keeping that in mind all the time is super important. So I know we're running a little bit short on time here, Danielle. I think we're getting ready to call it a day. Yes. One more quick thing that I just want to make sure that we hit on real quick in like the next minute. Audrey Lopez just said, we have someone here say kids can't get it and can't spread it. Can you ladies respond to that? Okay. I think that just real quick, I know that we've spoken about this before. It's not that kids can't get it, because they do. And it's not that kids can't spread it, because they can. If you look at the state's guidance for reopening, it says right there on one of the front pages that right now the evidence, and again, this is according to the state on their safely reopening guidelines. The state says, right now there's not a lot of evidence showing, they call it effective transmission from students, between students in schools. It actually says on there that staff to staff transmission is something that needs to be, very much watched out for. But that right now, just that there's not a lot of evidence of that. But again, that's not to say that students can't get it, and it's not to say that students can't spread it. And so I think we've had to do kind of a lot of myth dispelling in the last month or so of, the American Academy of Pediatrics, yes, they say that the risks of not going to school are greater than the risks of COVID for children. Right. So I just wanted to make sure that we address that it's not that they can't get it. It's not that they can't spread it. They just tend to, if they get it, not have as extreme of a reaction. And if they, that they don't spread it as rampantly as people would expect with like the flu or something like that. And one thing, if I may add to piggyback off of that, I spoke with Dr. Eduardo Alcantar for that story that I told you about, and he, as well as my kid's pediatrician, they both said, kids' bodies are so new and their immune systems are really, they don't have that that record of, colds and flus and all sorts of things that our bodies as adults do have. And so the children are really able to, their bodies are, thank goodness, they're so new, they're so ready to fight off whatever they do get, that their symptoms tend to be very, very minute. And in fact, that CDC study that I talked about, I mean, it was 8 out of 100,000 population, the kids that were hospitalized, compared to, I think the study said 164 adults. So think of that difference, 8 out of 100,000 population. And then again, those kids who were hospitalized were kids with underlying health conditions, such as obesity, such as diabetes, and lung issues. So you're right, they can get it, they can spread it, but thank goodness, it looks like their outcomes are looking really, really good if and when they do, and hopefully they don't.
Yes, definitely. I know that was kind of a heavy topic to bring in right at the end, but just wanted to make sure that, we see you, we're listening, and just wanted to address that. So, okay, well, we are pretty much out of time. This always goes by so fast. But thank you all so much for joining us. We have so many more resources and stories, our school reopening database at abc15.com/schools. And Carla and we will plan to see you back here on Facebook next Wednesday.
All right. Thank you guys for joining us. Bye, Danielle.
Bye.